Welcome back. Happy Saturday morning to you. Okay, we have a lot of veterans who live here in San Diego, and lots of changes are coming to the VA. Two bills made their way through both the Senate and the House this week. They passed, and those bills could change how our veterans get their health care. Terri Yurek, a health policy expert, is here to sort it all out. So, Terri, first I got to ask you, what does this mean for our veterans who are waiting to get in to see a doctor?
Yeah, absolutely. It means that our veterans are going to be able to access the private healthcare system, use the San Diego facilities like Sharp, Scripps, Tri-City, and get appointments right away.
So you mean that they can just pick a doctor and then bill the VA?
That's what it sounds like. So the way it has to be implemented, once this is down in black and white, they're not going to be asked to wait again. So I see one of two things probably happening. One, they're going to use a system that's already in place at the medical groups and the hospitals, something like a data system for CHAMP VA or TRICARE, and they're going to load that with data for all the new patients.
Okay.
Or it's going to be a voucher type system.
Okay. Now, also these bills, which of course, as we said, are not in black and white because they need to be reconciled.
Correct.
The president needs to sign it still. So we're still tentative about stuff.
It's a little clunky right now until the politics are worked out, right?
Right. Okay. So now, what does this mean for, I mean, the taxpayers in general are paying an enormous amount of money for this bill.
Yes.
And though our veterans need this care, I read a report from the Congressional Budget Office this morning that says this one particular issue will cost us more than the entire VA system as a whole.
Absolutely, and it is going to be a strain, with the whole Covered California shift, all the cost shifting with raising the poverty limit with Medi-Cal. That's been an economic strain right there.
Sure.
And about another $35 billion for this program. So yeah, it's going to be, a lot of cost for the taxpayer. But we do need an immediate fix, so I guess we're going to have to be working that out after the fact.
That seems like a dangerous way to go about it.
It does.
Right?
It does.
Okay, so these bills will also give the VA secretary some more power.
Yes.
In firing underperforming doctors, staff, perhaps these people that are creating these secret wait lists.
Right. Yeah, that needed to be done anyway, because what's going on, I mean, historically, VA management managed all the VA facilities, so there's no outside independent audits or anything like that. So having some control on that is a good thing, because it's going to make sure that people are doing their jobs.
Right.
And people are getting the care in the veteran system.
Right. Now, this extreme amount of money that is being thrown at this issue, do you believe that perhaps it's just a Band-Aid that's going to just continue to balloon and skyrocket out of control?
Not really. I think that, we need a fix right now, at least if they're on the back end of that, if they're working on getting the VA system and hospitals straightened out for these vets, we can transition them back in there. But for now, this is a big military town. We need to help these people.
Absolutely.
That's the bottom line.
Absolutely.
Let's put it out there. I've talked to a lot of hospitals and facilities in the last few days, and they are eager to reach out and help our vets. And it's a great positive experience that I've been having and hearing from them. So, let's do it. Let's move forward with it.
So now, say there's a veteran watching right now that has been sitting on a wait list for however many days.
Yeah.
What does that person need to be doing right now if they need to get in to see a doctor?
Right. They need to find a doctor, so that's important. So that's what I would do for my clients. So, there's a couple of ways to do that. It might be based on proximity. So, they have limited resources to get back and forth from a doctor's office, or they should ask their friends and family, who do you like? Who's your doctor? Or they can ask an agent like myself. We have all the tools to use the parameters that they have to help them find a specialist to care for their needs and things like that. So.
And so if they find that doctor, they select that doctor, and then the bill will get sent to the VA. Is what
That's correct. It'll be paid federally.
All right, Terri, very good information. A very interesting topic, especially for the hundreds of thousands of veterans we have here, and we need to get them in to see their doctors. We need to help them with their care. All right, thank you so much.
Thank you.
All right, you're watching Good Morning San Diego. We'll be right back with much more.